Call the meeting to order. We're going to start out today with our pledge. If you would rise, please. Our flag is here. Attention, salute. I pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Let's pause for a moment of silence, please. Thank you very much. Welcome to our monthly meeting. Before I start, Virginia Department of Health has issued a mask mandate to the schools of Virginia that applies to our meeting. Please consider abiding by that unless you have a medical issue that prevents it. Welcome to our monthly meeting. We are here to accomplish the business of schools for the sake of our students. We do want to hear from our citizens, and there is time for public comment prior to action items on the agenda. We ask that speakers identify themselves and their home district. We also ask that your comments are limited to 3 minutes in order to provide equity to all speakers and to ensure our meeting is reasonable in length. If you have more information that can be summarized in 3 minutes, please leave behind materials for the board's review. The moderator will ask you to conclude your remarks as time has elapsed. If you have questions during the session, you may ask for clarification from your school board member or a school administrator after the meeting is adjourned. Thank you for coming tonight. All right, do we have a motion to adopt the agenda for this evening?
So moved.
We have a motion, Mr. Grove. Is there a second?
Second.
Second from Ms. Bynum. Any comments? All in favor, aye?
Aye.
Aye, opposed, no. And so ordered. The next item is the school board liaison. Cassia.
And as Kessia is coming up, can I just remind everyone we do have Zoom going this evening? So I would appreciate everyone speaking very loud and clearly into their microphone because the audio has a tough time picking up if you're away from the mic. Thank you.
I can do that. I can do loud.
We can hear you.
So good evening, everybody. We have officially survived our first month of school. I think for many students, this year has kind of been an adjustment from the no mask to the yes mask to the changing on different protocols that we've been doing, but we've really adjusted to it, and I think we're doing a pretty good job of keeping with those as well as we can. So I know for many of us, we had our high hopes, and then we hit some barriers, and that kind of brought down morale for a little bit, but it's back up, and it's doing better, and it's getting better as we go on. In the last couple of weeks, our school has been getting its feet back into both school spirit and into sports. Lots of our sports are having their regular practices and their games. And these are actually games that people can attend now, which is really great because last year you couldn't at all. And so I know that many of my friends and many of the seniors are now going to the volleyball varsity games, and they're making their own student section, and they're very excited about it. And everybody is like, you should come, and you should be there. And it's a lot of morale being there and everything. And then we're having our first tailgate party on this Friday at the home football game, and people are very excited for that because even prior to COVID, that's not something Rappahannock did. So this is a big step forward for us in those kind of events for our school, and hopefully those continue. And then continue on that topic of school spirit, I would just like to give a small shout out to our new principal, Principal Seward, for being the guy that has the most excitement and energy in the room. It's fantastic. Because last week we had our SEA elections for the entire school, and those were great, but elections are so boring. And I say that as a person who has to watch them, and I say that as a person who has been in them. Even speaking, I am bored. But this election was very, very different compared to that. When we walked in, we all went into the gym, and everybody was there, and we were just kind of like, oh, this is going to be 45 minutes of us sitting here and maybe listening to these people, possibly. But Principal Seward came in, and he was very energetic, and he had a big group of the senior boys do the Rappahannock song, which was very entertaining. And then he had another senior come up and play Simon Says, which was also very entertaining. So he was really getting everybody's attention and getting us excited, and I think that helped us keep our attention on the speakers. And then I can't give all the credit to him for the excellent election that we had, because Miss Liberty, who is a fellow student, gave a very, very good rap session for her speech. It was very epic, and she did a mic drop as well. So that was lovely. And I think with that kind of, she's the SCA president now, so I think with the kind of spirit and effort that the principal and the SCA and the more student involvement that we're getting in these kind of activities, we're also trying to have seminar students participate in SCA as well as representatives. So we're getting a lot more student involvement in these kind of activities and in planning these kind of activities. So I see that as a big step for us this year, and I think it's going to help bring us back to a better normal for those kind of things. And then we have a big hope. I know seniors have lots of plans, and I think the other classes do, but for all the different events, like all the senior activities we're going to do, because now we can. But there's lots of pep rallies and sports activities and spirit weeks being planned on the horizon. So we're very excited about those. And then switching topics real quick to something of same importance, but still more on the health side of everything. I just wanted to bring attention to mask breaks for our students. So for some of our students, their mask breaks are limited to almost non-existent. I've asked multiple students around the school, kind of just in different grades, randomly picked out, and some of them were like, I've only had 2 in the past however long we've been in school. And others are like, I have 1 in every single block, which is fantastic. And some are like, I have a guaranteed 1 in this class, and sometimes we go out in other classes. And the point here is just that it's inconsistent, which hurts for the students who don't have the teachers who are constantly taking them outside. And so I would just say that the mask breaks are crucial to the students for their learning and for their focus, because lots of people get headaches with them kind of thing, and then they just don't pay attention in class. And then for their health in general is a big concern. But then I also understand that teachers have their own issues with the mask breaks and their own reasons for not doing them or for doing them. But some of this has to do with weather, their personal reasons. They're afraid that they won't have enough time to teach the lesson, because to do the mask breaks, you have to go from wherever you're in the building all the way outside around the track a few times and then come in. So it is time consuming. Or the genuine assumption that they think that these children have all been taken out in the block beforehand, so they don't need to do it. So that happens. So with that said, I would just like to stress the need for some kind of organized or scheduled mask break during the day. Students do have lunch that kind of hits the middle of the day, so maybe if there was a scheduled mask break in the morning and a scheduled mask break in the afternoon, that would be enough to kind of do that. And then some kind of backup plan for the winter, because nobody's going to go outside when it's like 20 degrees. So that is a concern, because I know during the winter, even last year, there isn't really a place to go to have your mask breaks in the winter. So that was a concern for people, because then they didn't really know what to do, and I don't think the teachers knew what to do either. So that was a concern. But other than that, I think we're off to a really good start, and there's a lot of good spirit happening, and we're very excited for what this year could be. And I just want to say that. Thank you.
Great. Hold on a second. Anybody any questions? No? I do. Hey, could you ask the students if they have any good ideas about what to do in the winter for mask break?
I can definitely do that,
Just
yeah.
try to get those ideas back
Of
to
course.
us and see, because I like the schedule idea. It's a good idea. We just need to float these ideas up to see how we can implement different things
Yeah, I mean-
consistently. So I appreciate you speaking to that.
There are lots of schools, including preschools, that the kids just have jackets and mittens and they go outside every day in all weather. And that's a really healthy thing to do. And I think that's a great thing to structure in. We're in charge, right? So we can make that structure. We can. So this is the right place to take that idea. I
Yeah.
appreciate your bringing it.
Anything that will help us have some time to breathe a little bit more.
Hey, also tell your friends that are going to these games,
Mhm.
it's a remarkably different volleyball game when the student section is there, because they are so loud. And
Yeah.
all of a sudden, the other team, it's intimidating if you're the other team and there's a student section. So yeah, I think it's great to encourage your fellow students to
They're
come.
all very excited. I know for like the past week, we just keep hearing people go, don't do anything on Tuesday. We have a volleyball game on Tuesday. You have to be there. Everybody has to be there.
Yeah, and so the trick is they can do a lot of things until the principal comes over and says that's too much, right? So you got to figure out where that limit is, right? But anyway, it's great to see the students there, and I'm glad they're starting to reintegrate. It's good to see. Yeah, thanks.
Thank you.
Thanks. Donations.
The Salem Education Foundation donated $1,000 for teacher supplies. Mitchell May and Lauren May donated $1,000 for student needs. And Philip Vaughn and Barbara Sisk donated $35 for flea and tick medication for the ag program.
All right, thank you. The next thing on the agenda, and the donations are accepting of the donations are part of the consent agenda. The next thing on the agenda is the minutes from our August 4th and August 10th meeting. We've had a chance to review them. Is there a motion to adopt these minutes?
So moved.
We have a motion from Mr. Grove. Is there a second?
Second.
Second from Mr. Rubin. Any comment? All in favor, aye? Aye. Opposed, no. And so ordered. Mr. Grove, have you had opportunity to review bills?
I have, and everything looks to be in order.
Thank you. Is there a motion to approve the consent agenda, which contains the approval of donations, the paying of the bills, the attendance report, and the homeschool report?
So moved.
We have a motion from Ms. Bynum. Is there a second?
Second.
Second from Ms. Meyer. All in favor, aye? Aye. Opposed, no. So ordered, Madam Superintendent. The
Thank you,
floor is
Mr.
yours.
Thank you, Mr. Chairman. The first item, 4.1, is an overview of our local contact tracing process. So Robin Murray, our CES nurse and COVID team leader, and the team are here to share in this as well. But I will start it off. Give me just a second here. All right. So lots happened since we started school. If you remember, we developed this system last year, a dynamic data-driven decision-making process that is designed to use actual contextualized data that occurs in your buildings, in your community, to make decisions about where you're going next. Let me move this bar out of the way. I'm not used to having Zoom on my screen. Here we go. All right. So as of August 3rd, using that logic, we looked at our data, and it still looked pretty decent compared using what we had put in place last year. So looking at those trends, and then a lot of discussion happened in between there with state guidance changes and a lot of people in Richmond trying to figure things out as well. Rappahannock starts really early in the school year comparatively to other school districts. So we were sort of thrown into this, figuring it out as we were building the plane in the air, with a lot of guidance coming up from Richmond, a lot of information in the community, a lot of controversy over a lot of different things. So everyone, I think, knows how collectively we arrived at this point. A lot of legal considerations that we were trying to figure out and really quickly about access to learning and funding, understanding what extent practicable means, vague language in some of these orders, and how to deal with some exemption language and all of these pieces. So it was a lot to figure out in short order after we had already started, which we are sorry for that we had to go through all those motions. So the school board gave consensus to continue using a data-driven dynamic decision-making matrix, layering additional mitigation as data indicated. And that included masking mandates with the governor's order initially, because of the language there seemed to imply that you did have some flexibility. After we started, the health commissioner put out a more clarified emergency language that then stated that yes, now everyone, regardless of vaccination status, despite CDC, even though they said high transmission areas only, now in K-12 settings, everyone should be masked. However, there were those exemptions to deal with, and different schools, it's still in the order that you can provide medical exemptions and certain religious objection exemptions. Okay. So the school year began, and we very quickly saw how the Delta variant was very contagious as soon as it infiltrated the school doors. So when we had that happen, and using the parameters that we have from VDH, the quarantining was exploding very quickly with very few cases initially. All right, so with that, when you have everyone in, and at the beginning, we weren't cohorting students for lunch and recess. We had normal safe sports PE. There were optional maskings at first, but then it was encouraged except those who applied for an exemption. And even at the beginning of the year, we had very few exemptions at the elementary school. Only 15 students, parents applied for exemptions at the elementary. And we still had quite a few quarantines and cases happening there. Many more at the high school. But when we had to go into containment mode, when we had those cases skyrocket that first week, that's when we put in place everything we could. We closed down for that 4-day period to really look at all the cases, do our local contact tracing, consult with VDH experts, and then implement some of these things. And as you can see, that's what the data did that first couple weeks. So 32 cases in the school district in that first 2 weeks. So I'll show some more when I do the well check about our data and how that's changed. But I do want to invite Robin Murray to the podium to go through this because VDH is awesome. They are wonderful, but tracing at that level is very tedious and time consuming, and you're waiting days before the interview for the first exposed person or the positive person is interviewed. And by then, when that time has elapsed and then you're talking to those who are exposed, more time goes and the risk goes up. So every hour that goes by increases that risk for additional exposures, right? So we needed that short switch to distance learning, regroup, and find a new solution because we were watching other schools around us too, and I'll show you a data chart about that too. And a lot of them did start. Like there was quite a few that said, you know, masks required for everybody, but they were having the same issues, lots of quarantines, lots of cases. So something had to change, and we think we found the solution, and we'll tell you why.
All right, so thank you, board, for having us here tonight. And first, before I get started on this, it's going to be in the future slide, but I'm going to introduce these ladies, and I just want to thank everybody in the community and staff and board and Dr. Grimsley for support in this. And so we have Tanya Cox, who is helping do a lot of our data collection. We have Lee Bernstein, who's helping us with a lot of our different Facebook that we're going to be promoting tonight and different software. And then we have Miss Viviana, who has been helping us with all of our translation. We also have Courtney Actons, who's the high school school nurse and athletic director. And then we also have Michelle Fincham, who also oversees a lot of our data. So let's talk real quick. So Rappahannock, you guys know when we started school the very first day, we had a positive case. And as these cases started coming in, we were like, okay, maybe it's just going to be a couple. And we found that to be very different than what we expected. And so based on our data, we sat down and had a meeting with Dr. Grimsley and with our epidemiologist and at VDH and said, listen, we have a problem. We started school before any other school district. This is what we're seeing. How do we stop it? And at that time, VDH gave us the direction to not close, to follow the process, to continue to quarantine, to trust the system. And I did not feel comfortable with that. So in conversation with Dr. Grimsley, I requested that we do a short-term distance learning because I felt confident, as strong as this community is, that we could step into place, work with the teachers, work with administration, and we could get a plan back into action because we know what worked last year. And the data's there. We only had 13 positive cases last year, the entire year. We're at 43. So in that time, we had about 12 cases, and so we switched to distance learning.
And let's talk about what that looked like. Right away, we knew when we restarted school on that Monday that we were going to do cohorting of students for lunches and recesses. Lunch returned to the classroom instead of being in the cafeteria, because that was our number one place for quarantine. We returned to separated recess by class. We put all of the pandemic safe protocols back in for sports and PE when they resumed. We put, I said, breakfast and lunch in the classroom, universal masking for all students regardless of vaccine status. So we even told the people who had previously put in medical reasons and filled out those to mask for the next 30 days. And then we had additional cleaning and disinfecting. That was something that didn't go away from last year. We kept that. Plexiglass barriers, we started with those. Distance whenever possible, we were already doing. And then we restructured schedules. Administration and teachers all worked very hard for those 4 days. They were in here in person and rescheduled the whole structure of how we were going to do classes and exploratories. So thank you to the teachers for the hours they put in. We did limit the exploratory from a 6-day rotation to a 2-day rotation. And then what we were finding when we went and did observations of all the classrooms is spacing. So last year we had, less students in the building and we were here less days. So you bring all your students back and you try to fit 22 people in a classroom 3 feet apart. What we found was potting, and that has been our number one success in keeping our quarantine numbers down. And what we do is we pod the students together based on numbers, and there'll be a picture of that, so I'll go more into detail in a minute. So potting and seating is a huge factor in us being successful with this model. So Dr. Grimsley gave us this amazing name, NCIS, No COVID in School. So, and that is, we have worked and trained and gone through the process. We have also walked Dr. Grimsley and our administration through this entire process until 10 o'clock one night. So they got to see the process. We had each of us sign confidentiality agreements. Each team member has a specific role, and they did do a stipend for us, so thank you for that. Teamworks, we work with the teachers and the staff, and mitigation processes that we put back into place. And then educating the parents is what we have found has been the number one thing that we need to continue to do in our community. All right, so you have Tanya, she's doing demographic and she's doing all of her demographic collecting. Michelle, data entry. Lee Bernstein has helped with all of our internal data spreadsheets that would blow your mind if we could show them to you, but we can't show them to you. And then we have Viviana, who's been translating and doing all of our coordination for seating charts and bus charts. Courtney Atkins, who's been our backup go-to. And then all of the group is responsible for interviews, contact tracing, and phone calls of exposures. Then we have, this is our tool. So on the board, you can see that the teachers, they worked so hard. We went into every classroom and took a picture, an aerial view of every classroom. And with that, it helps us, not only we can zoom in and count tiles and see how far each desk is, but we can have a better idea, because if you look, we had all of our teachers put seating charts into PowerSchool or Google. And with that, it makes it really hard to see a visual. So on the left, you'll see this is a kindergarten classroom, and on the right is a 4th grade classroom. But we've had even up to our high school classrooms try to pod. And the podding, as long as they are 3 feet from another pod, or 6 feet when they're eating in the classroom, then you limit your quarantine to 1 or 2 people versus 6 to 8 people, because of the diameter if they're sitting in rows. So it took a little bit of science and playing with several classrooms, but we did figure this out, and it's been super helpful. I cannot thank our elementary school teachers enough. They have gone to be so detailed. If you see this chart, every child has a number or a color, and every child sits on the carpet the same way they sit at their desk, next to the same person they sit at their desk, and that is also the same person that they line up with and walk through the halls with. So if they're going to be, if student number 6 is positive, then we look at student number 5 and 7 versus the entire class. So we would like to get, and VDH would like for us to get, to where we do not quarantine an entire class, but we quarantine close contacts. So thank you to our teachers, and we also have the same thing for our bus drivers. Then you have a little glimpse of what our COVID tracking system looks like. This database is unbelievable. So thank you to Lee and all of us. I mean, it constantly changes, and we come up with new ideas of what's working and what's not. If we have a positive case, they're entered in. There's actually a way for you to scan a QR code and let us know that you're positive. It sends an email alert to the entire team, and it's entered into our database right away. Then we take that information, and on each individual student, there's a form that looks like this. All of that information is set up to collectively add to our quarantine list, so we can actually see that we've had 373 students quarantined, most of them multiple times, but since the beginning, and most of them are related to the same case. So some of them are on there multiple times, but it doesn't mean that, you know, they've had 373 of them. It's just multiple times. And so, but on the side, it also tells us how many students are quarantined, how many staff are quarantined, and how many people are affected by each individual case, when they can return, and then all of that information is collectively added into our main front sheet that shows how many cases we've had. So, and it's also in a Spanish version. So, thank you, Viviana. So, yeah, so this is pretty amazing, and I will say that VDH has asked for this template so that they can share it with other school systems. So we will be going on the road and presenting. So that's really exciting, right? We have more time for that. All right, so next, we heard the parents, we heard the staff, and we heard everybody asking for transparency. It's not that we were not trying to be transparent. I know the phone calls that Ms. Johnson and Dr. Grimsley were putting out were very time consuming, and I asked Shannon, we both talked about a dashboard last year. We saw that several other school systems were doing a dashboard, and I was like, we need to do a dashboard. So Holly Jenkins, thank you to her, put this fabulous dashboard together, and I report to her every Monday, Wednesday, and Friday with the number of students in the elementary school and high school, staff in both locations, and the amount of students that we have quarantined. So I do want to point out to parents in the audience that please note on the bottom of our dashboard, and for the board members, if you're looking at it, it only demonstrates and shows the people that are affected by our school system. So if a student calls and they tested positive, but they weren't in our building for greater than 48 hours, it is not counted in our dashboard because it does not count towards our school system. So that's where you need to go to VDH and you need to follow their dashboard, because if it hasn't been 48 hours that the child's been in the building, then it hasn't exposed any of our staff or students. So we do not report that one on our dashboard. Then we have this next slide. I really wanted to try to capture, I know we can't show you our caseload because it has student names. I really wanted to capture for you guys what we saw in the beginning is the screen on the left. And this was before the shutdown. And we were seeing huge numbers of students being quarantined and affected by the way we were doing things and things that were in place. I can tell you that the 68 number was because of the cafeteria and the gym. So those were the two things that we had to look at right away. And you can see after our shutdown what happened. So you'll see two different colors up there. Red means on our main display case that that case can come off the dashboard. That's all the colors are. Green means it's still an active case. And this was from a few days ago. So, but you can see how our numbers of quarantine dropped off. And it's really cool to look at the dashboard and see what our shutdown did. And VDH did request that information as well. And they're looking into how we did that. So then the next thing that I wanted to do is educate parents and staff and on symptoms that we're seeing. So the first three are the most common symptoms that I'm seeing: scratchy or sore throat, congestion, headache, cough. I'm sure most of the people in this room have suffered from common allergies. Every person who has told me that it's just allergies test positive. So fever, I've had less than 6 cases develop a fever. Smell and taste, less than 4 started with that symptom and less than 10 have it after the 10 days or progress within 10 days. Upset stomach, we've seen nausea and diarrhea, but the most symptoms are mild and resemble that common cold or allergies. So if your child has those symptoms, please keep them home. Contact the COVID hotline, which is my cell phone number, and go through that with us before they return. And most students have had 2 or less symptoms at once. So everybody thinks that COVID, you have to have all the symptoms. You don't. You can have 1 or 2 symptoms and you're positive, okay? And that's just from our symptom data. I'm only going by what we're seeing in our school system. All right, so what are some questions that we're getting from the general public that we're going to have on Facebook is, can I get COVID if I'm vaccinated? This is the #1 question that I get. And the answer is yes. Vaccines are not 100% effective at preventing infection. Vaccines are effective at preventing infection, serious illness, and death. So you can see that on the cdc.gov website, and they are made to help lessen the effects of COVID. I will tell you what we're seeing with vaccinated people that are testing positive. They typically do not start with symptoms until day 5 to 10 of an exposure. All right, so most people start with symptoms in day 2 to 4. We're seeing later in the symptom pattern because you're vaccinated. #2 is, do you have to have a fever or don't you have to have a fever to have COVID? You do not have to have a fever. As you saw, a majority of my students have not had a fever. A fever is considered 100.4 or higher. A majority of what I'm seeing is between 98 and 99, okay? And that's not classified as a fever. Do siblings have to quarantine if my child is considered a close contact to exposure? They do not. And that is because they were not directly exposed. So if the exposed person then starts with symptoms, then everybody in the household has to quarantine unless you're vaccinated. Vaccinated people can return to work and normal activities unless they start with symptoms. So the rule of thumb here is, if you have any symptoms, stay home and keep your family home until you're tested and proven to be negative. So that's the biggest questions that we get as a COVID team that I wanted to go over tonight. All right, scenarios. So these are the exact same scenarios. You guys remember the reopening plan that we had last year? These are printed in the reopening plan, and these are what we used to send students home last year. #1, if you have symptoms present and we are in a no risk or low risk of transmission in our community, then you just stay home for 24 hours until you're fever-free and symptoms have improved, okay? #2 is symptoms present and you've had a known exposure. You have to stay home for 10 days from the first day of symptoms. You have to, if you have a negative COVID test, they say 10-day quarantine from the first day of symptoms due to the exposure. If you have a positive COVID test, there's no question, everybody gets a 10-day quarantine with a positive COVID test from the first day of symptoms. The next one is what we're in right now. So symptoms are present, but there's no risk of exposure, but we are in a moderate to high risk. We are in a high risk in Rappahannock County right now, and these are the only 4 ways that you can get your child back to school. You can either stay home for 10 days from the first symptom, if they have symptoms, so this is symptoms present. Negative test, and they are fever-free and symptoms are improving within 24 hours. Positive test, there that is again. No matter what, you stay home for 10 days. And then you can return if you get an alternate diagnosis, such as if your child had a headache and they have known headaches, or they have asthma and they have known asthma and they have a cough, or they have a earache, those types of things. So if it's a known diagnosis and it's alternate and they are fever-free and their symptoms are improving, they can return in 24 hours. So those are our return scenarios that we have. And then, yeah, do you want to talk about this? Because you developed the whole thing.
Okay, so basically, it's pretty straightforward. We have a Facebook page that is called the RCPS Nurses Corner. It did exist before today, but now it officially has things on it. This is what the front of it looks like. Now, we've developed this page. Right now, it will obviously do a lot of conversation about COVID, educating, providing information about upcoming clinics, types of symptoms we're seeing. If you go on the page, you will see we pin the link to the Google form where you can report those positive cases, and it has our COVID hotline number on it. But this is also, hopefully going forward, going to be a space that both Nurse Atkins and Nurse Murray can use just for public health information. So, reminders about, how to wash your hands. It's flu season. What does that mean? What does it look like? How to keep you in, it's flu season. Stay home, take a nap, catch up on sleep, things like that. So the goal of this is not just to be COVID centered, but obviously I think it will have a lot of discussion on that. And we will be launching, keep an eye on it, because there will be an incentive to follow it launching in the next few days. So if you're only in it for the prizes.
Thank you, Lee. So I just want to say again, we at this community has been the most innovative community that I've seen to make sure that we are doing the best for our students, keeping our staff safe, and then also just loving our community. So thank you so much for your support. We continue to answer questions as much as we can. And just remember that we're going by VDH guidelines, and as things change, we will make sure that you guys are updated.
Thanks, Robin.
Thank you.
Any questions for Robin or the team?
I've got it.
Go ahead.
Yeah, Robin, if you can go back to, I don't know, where are we here? Where you report, if a COVID positive is reported and the student has not been in school for 48 hours, then that's not a school case. Is that so?
Correct.
Is that what you said? But then explain to me how there's a 5 to 7 day incubation period. If a youngster is reported on a Monday, they haven't been in school for 2 days, but they could have been positive Friday or Thursday, why that's not a school case?
So the way we do that is the VDH says we go by a 48-hour prior to symptom onset. So the best example of this is that if they do start on Monday and you back up 48 hours, takes us to Saturday, and so they were not around anybody on Friday, or, if they were around them, they weren't considered contagious yet. Your body doesn't, so once you get your viral load, your body doesn't start shedding the virus until 48 hours prior to you starting symptoms. So VDH has us go by the 48-hour rule, and that's how they have us contact trace.
Okay, all right.
And based on our data, that's what we're
It just
seeing
made more
to be true.
common sense to say that you said there was a 5 to 7 day incubation period, but if that incubation period is.
That's for vaccinated. What we're seeing is and that's not, it's not an incubation period. So for your vaccinated people, we're not seeing them. So if they've been exposed, so say I'm exposed on Monday and I'm vaccinated, then typically what we're seeing with those people is that the exposed person doesn't start with symptoms if they're vaccinated until probably day 5.
I see.
So that's when but when that person starts with symptoms, then we back up everything that they did on Thursday and on Wednesday, and we contact trace all
There
of
you
that.
go, okay, so that's
Yeah.
the caveat.
Yes,
Okay.
yep.
All right.
Yeah, and just so you guys know, a typical case in the beginning took us about 6 to 8 hours to contact trace. We pull video footage, we pull bus cameras, we go in and measure the rooms. Dr. Grimsley has seen this all. And so a large case can take us around 6 hours, and then a medium case for our school system is anywhere between 3-4 hours, and then a smaller case that doesn't really affect anybody takes 1 to 2 hours.
I
Yeah.
just want to commend you. It's phenomenal.
We all should be
This team
commending
has
you.
been amazing.
That to be a nurse in a public school system today, I don't think we understand. And when you check out at the end of the day, that's not the end of your day. I know that the phone continues to ring and there's people you got to call, and it's so you made a career choice, a change at probably a terrible time, right?
So I took this job
Anyway.
in October of 2020.
Yeah.
Never
So,
expecting
never
that
expect,
it would be
right.
like this, but
So
yes.
anyway,
Yeah, thank
say
you.
thanks to your team, and
Thank you.
and
I
it's
actually
hard
have a
work,
question
yeah.
as well, Mr.
Yep.
Mills. Thanks. I have 2 questions, actually. They're going back to the dashboard for a minute. So if we're going to learn something from what has happened in this past month, where we had a case at the beginning, we had an explosion of cases just after the incubation period where we had very crowded, unmasked events right in this school and in the other school. If we're going to learn anything from what happened, it would be really helpful for the school to provide data over time. The piece of this dashboard that's confusing and doesn't feel very transparent is that we're not seeing, all we're seeing is a snapshot, right?
Right.
We're not, like usually you can navigate, in my experience when I've looked at dashboard, you can navigate it, you can say, well, where were we a week ago? Where were we 2 weeks ago? And then you could see a line that might look like this, and then it might kind of go down. And then we could say, oh, well, what happened when it went down? Oh, we started wearing masks. Everybody started wearing masks, not just people who felt like wearing masks. And so that would be helpful for us to keep an institutional memory about what happened and all the quarantines and the stress, frankly, that happened when we had so many people quarantined, both on the side of families who had to have kids home and on the side of people who were worried that they might get really sick or they might spread it to other family members. So I'd love to see an amendment. I know you have the old dashboards of data over time so that we can learn something, because we're not actually only living in the present. You know, we're a school, we're about learning, and we learn from mistakes. You know, in farming, we say you
So-
harvest your mistakes, and that's how we can make progress. So I'd love to see that.
So
1.5.
isn't that, so this VDH is a time, the VDH display, that's the dashboard VDH, it is a time domain.
Mhm.
It shows us that over time, right? If we integrated
Correct.
part of the VDH display into our presentation,
Mhm.
It would give us more of
Yeah,
the time,
that would be
Yeah.
appropriate.
and it
In the
wouldn't
well
require
check-
us to do the work.
Yeah.
I don't want to get ahead of you guys, but in the well check, I am collecting that, and I'll show you a chart, and if you guys are okay with
Okay.
that, that's what we'll.
That would be wonderful, yeah. And so the
Hey,
other
we
question,
could do a Rappahannock VDH chart.
we could. It
Without-
would be
I mean,
Too much
they might
trouble, right?
actually
Yeah.
have us running VDH soon, so.
Yeah, there you go. You could double
They are
pay, right?
Well,
You have to split your hours with time turners.
Yeah.
They can't have you.
No.
They cannot have you.
So,
It-
but yeah.
That does bring up a point, and they are, so other counties are gonna start calling, right?
They already have.
For help,
Yeah.
and we gotta figure out a good billing model, right? So let's figure that out, right? Because we've worked hard and we've learned a lot and we've got tools, and we're gonna be sharing those, but
Yeah, and my other question, I'm sorry, Robin.
You're fine.
I didn't mean
go ahead, go ahead.
but to run over you, Mr. Mills. But the question about symptoms, like I've read quite a bit about asymptomatic spread, and I'm just curious where that guidance comes from. You know, I've heard of people who are vaccinated having high viral loads, but then just kind of feeling like it was allergies and it wasn't anything. Or
Right.
and that's, so how should we be dealing? Should we be advising testing with slight symptoms, or I'm just wondering what they're saying, what you're
Yes.
saying as a medical professional on that.
So prior to, I don't know if anybody's been watching the numbers, but a couple days ago, VDH reported 4,400 positive cases in the state of Virginia in one
A
day.
little bit closer to the microphone.
So they reported 4,400 positive cases in one day in the state of Virginia. And so I don't know if you've been watching that dashboard, but it's very interesting to me. And here's the issue, and this is, subject to change constantly with VDH, but we are working with them and we've given them suggestions because we are not seeing the classic symptoms. It is like a common cold, but to answer your question is not only, we have only had one asymptomatic positive, so just so you know, we have been keeping that data. And so with that though, what we're seeing with these symptoms are pretty widespread in other counties. If you start talking to them, that's what they're seeing as well, these common allergy symptoms. And so I can tell you that testing sites are inundated right now. I have 2 people who literally could not find anywhere to test the past 2 days, and they can't get an appointment until Friday. Okay, so that's a real issue with testing. So if you are asymptomatic, I do not encourage you to get tested, and most test sites will even decline you right now because they are only taking the sick people to test. And so it's hard because we do know there is data out there that there are asymptomatic people. And so I would be careful with just going and getting tested if you've been called an exposure. If you develop symptoms, then go get tested.
And I just heard today from a Valley Health nurse that they don't have any beds left.
There's
so
no test.
although we've had only mild cases here, that's not really, we're very lucky at this point, and the more
We are
cases we
extremely
have,
lucky.
the more serious cases we might have.
Yes,
Should we not invest in some rapid testing?
we're actually doing that.
We are,
We're
actually,
investigating
there's a
it.
couple things. So with our wellness center, we do offer point of care testing, especially for symptomatic individuals that get triaged through the nurse's clinic that can go and get a test with consents that are signed. So that's great. The volume has been higher. So we are working with BDH right now. The state itself has a VISTA screening program. We are more interested in diagnostic on the point testing because we've gotten it so close now we can really hone in a screening. And as our BDH epidemiologist said, that really wouldn't do anything for you all except get your percent positivity rate down, not really help you get to the cases you need to. So in that case, we're looking at diagnostic on top of our wellness center. So hopefully we can get those kits here. There's some hoops we have to jump through and get a CLIA waivers with a standard order and all of that stuff. So we are working on that right now.
Wonderful.
That's great.
Thank you so much for
Thank
all
you,
your
guys.
work.
Are there any other
Yeah.
questions? Hey, thanks for everything.
So you're going on the road and you're gonna teach everybody else how to do this?
We'll see. They're calling already.
They are, yes. Thank you, ladies, so much.
It would be a good program for the conference.
Actually, they've been talking to us right now, and when I get to the well check and some of these other presentations at the end, I'll kind of show you what we're talking about, what we're seeing in other schools, because primarily the masking became such the main issue that it kind of gave a lot of people, ourselves included, I think, a false sense of security once we were masked. And then you really have to hone in on some of these other pieces because it's like Swiss cheese layered. Okay, the holes aren't in the same place, right? But when you put them all together, you can get as much coverage as you can. So looking at all of those pieces, but the contact tracing is the critical piece because what happens with Delta, as we've seen, you have, whereas the old Alpha COVID was one case, you get 2 or 3 maybe. Other ones, one case can expose and go to about 8. So if you can't hone in on that initial exposure, identify those exposures, 1 to 8 ratio, it gets an exponential growth. Mask or no mask, because a lot of these places will have PE, exercise, lunch, and kids, so it will get exponential regardless. So that's where they're struggling because they said, okay, we did all of these things, but then the local contact tracing team and staff capacity in schools is one of the number one things. And then the pods have been super helpful and setting up classrooms strategically, and teachers really gave us great feedback, like Robin was saying about the numbers and the cohorts and keeping little groups of students together. It is a little stressful because we were very excited to get people together and the kids, but the kids are adjusting. And I think what we saw was, and when we get, like I said to the other one, our community just banded together, and we haven't had issues with compliance, and they've been cooperating, and they understand. And basically the quarantines, regardless of how we feel about transmission rates in mass. What is irrefutable is the diameter doubles for quarantine circles. So if you do that math, I can, guarantee that if you're not masked, you have a much higher chance of being quarantined and having to stay home based on BDH guidance. So that's what we're trying to limit with our distancing and all of these things. We have to follow BDH rules. They make the rules. We just play the game. But we're trying to find creative ways to play it in a way that gives kids that sense of spirit and a fun school experience despite all the challenges we've had. So thank you, ladies. That team is incredible. It started off as a joke because I'd walk by their situation room, as they call it. It's very confidential, and nobody can go in there except very authorized personnel. And it seriously looks like a situation room from NCIS. So I would say that, I'm like, man, NCIS, they got the big board and all these charts and bubbles and video going. I'm like, oh my gosh. And then it hit me one day. I'm like, no, NCIS, we need an acronym for that. No COVID in schools. And that became the
I
joke.
want to do it in New Orleans.
What was it?
The NCIS in New Orleans.
Ooh, that'd be fun. All right, so moving on, 4.2 is the food service bids that were given to me by the nutrition department. And every year I just make you aware of the vendors that the cafeterias will be using. Pretty much the same list that we have used. Micro purchases will continue through local farmers throughout the year that don't necessarily fall under a bid. And we're still using Meals Plus for our software. And please don't ask me too many questions about this because this is not my expertise area, but they have it well under control. Miss Julie Banks and Karen McCracken have taken a more active role in running the cafeterias. They're doing an outstanding job.
Good.
All right, new state growth assessments. I did want to update the board on this. I know there's been a lot of information out in the media about how Virginia is now assessing students. So for testing and accreditation, our annual accreditation is waived again, as are all other schools for the 21-22 academic year because of the continuing impact of COVID. We've seen significant learning loss state and nationwide because of the pandemic, and unfinished learning needs to be assessed and addressed. Of course, we know the educational consequences that we've had, the interrupted and disrupted learning environment, opportunity gaps greatly exacerbated, especially for students in poverty and those who lack internet access. There's limitations of standardized tests, which reward that narrow set of skills, and especially more affluent students. So what we were really talking to the state quite a bit about was that we need resources and relief so we can provide effective remote learning. School systems needed to invest in extra supports and interventions resources to ameliorate those gaps that we're seeing, and that's what we've done a lot with our instruction plan this year. Also must rebuild and redesign our conventional systems to integrate cognitive development with socio-emotional skill development intertwined, because we saw a great deal of gap there. So here, I'm sorry, this went away. So this is what we did last year when we saw that the impact was having, even with our partial in-person. After examining our first quarter grades last year, it became abundantly clear failing grades were due to more remote learning behavior rather than what students actually knew. And that became a real diagnostic measure we needed to hone in on to be sure we understood what mastery the level of mastery our students really had, and what interventions would we need to invest in coming the next year if we could get more in-person time with students. So last year we did additional time to make up assignments. We used Wednesday school, Saturday study hall, additional resources, and we implemented social emotional learning curriculum. Our testing outcomes from last year, remember they did give SOLs. It's kind of skewed data because we had a lot of remote learners and some refused to participate statewide. And so the data isn't great, but it's a good data point to show where we're kind of starting off. We were pretty decent in reading, and so is the state. So here you see RCES, RCHS, RCPS as a division compared to the state bar that's all the way on the right. So in reading, we held our own pretty well. Saw very little loss there, and that was a huge concentration was on the reading, especially in primary, because we were most concerned with that loss because it takes so much critical literacy development, phonological awareness, and all those things are very difficult to do if you're not in person, and when you can't see somebody's face too. So we put a lot of attention into this, and so did the state. That was an area of concern statewide. Math, nobody did that well in math. The cumulative skills development, we saw the similar learning loss that happened in math as the state did. And that's why you saw the hiring of a math specialist to address this concern for this year. So we use this data to use our ESSER funds strategically to address whatever gaps that we saw. Science, kind of the similar thing. We didn't have time slot allocations very much for other subjects. Math and reading were, especially reading and literacy were among the top priorities statewide, and that came from state guidance and from the school system. So science we need to build back up, which is usually pretty simple to do once you have more hands-on learning and labs and those opportunities with kids in the classroom. And as you remember, last year we had a lot of waivers with these tests because you could locally award verified credit that would not be measured on a standardized test with other artifacts. And we were really close. A lot of our LABC eligibility rates got us to a point where we were in the 90s with a pass rate if you were to combine those numbers. So we were, even with those scores, a little lower than we'd like. When you combine the eligibility LABC, the local awarded verified credit combination rate, Rappahannock was very successful and our students graduated and didn't have to miss out on those requirements. And the state gave that flexibility to all schools, seeing that same similar scaled gap, if that makes sense. So the new growth assessments, I'm sorry, I'm trying to manage Zoom and this at the same time. I can juggle just. All right, so the new growth assessments in 2021, Virginia General Assembly action required these new assessments to be completed by students in the fall and spring 2020, this school year, 21-22, in grades 3 through 8, reading and math to measure growth. This is something we've been talking about for quite a long time, and something we were trying to develop ourselves through performance matter assessments and pre-tests, and so we've been in this camp for a very long time. Measure growth and give us credit for showing progress with students. Growth assessments won't provide a pass-fail. This is really diagnostic only. So the focus will be on identifying what students have learned, what skills they need help with during the school year. And the full implementation of these won't happen until the next school year. So let's slide back. These tests typically are administered, and these will be the same ones for the growth assessments. They're going to assess prior year content up to a point to determine at what level the gap exists between the entire curriculum taught and that continues to be. So it's a true growth measure. For those who are accelerated, it will also go into current year content as well and tell us, okay, maybe you did really well remote learning and you just kind of went through the content. It will tell us at what level you're at too. So we don't want to forget our gifted students either. We want to be sure they're accelerating and continuing to be enriched too. It's about everybody should show growth. So what is it going to report? It's going to give us a really good student detail by question data points to tell us at what level students are achieving, what content is missing, and where we should, and at what level of difficulty, depth of knowledge the students are performing at. They are working to develop a parent portal. By they, I mean BDOE, the State Department of Education. And they hope to have this out in late fall, where parents can actually go in, get a claim code, and see how their students are faring on these assessments. So we're hopeful for that. We've actually given several already over the past couple of weeks. So we're really interested in seeing that data. And then they are finally going to use this stuff in accrediting schools eventually when the accreditation is no longer waived. And the way they're going to do that is they take your base pass rate, I have a little chart here, and if you show student growth in that content area, they will add that student. And also, they're paying a lot more attention to your English language learners. So if you make language proficiency progress with those students, they will also add. So your test rate may have been a 6, your pass rate would have been a 6 out of 10, 60%. on this example, but with the combined growth rates added, now you're at an 80% combined rate because you're showing growth. So that's in a nutshell what the growth assessments are. They're shorter assessments. The students are doing pretty well with them. It doesn't take too much time. Test administration is very similar to SOLs, but not the same level of intensity, I think. Any questions?
That was actually my question about, so what is it like for the students? Like, they're having two sets of tests, which are often sort of anxiety producing to students.
Yeah, so
How
there's
do you deal with that?
the administration of them is similar. There, it's not as strict as the SOL. So we're finding the students are just, this is for us to know where you're at. There's no, it's nothing punitive, no
Yeah.
grade, no pass fail. So the kids are like, oh, thank you, that's my kind of test.
Yeah,
So it's
so
been
you're
much
clear
better.
with the kids about that, but it's not.
Yeah,
Yeah. So that's the way we've been
It's not
presenting it. And they, so far I haven't heard of any concerns with that. And it hasn't been made a big issue because it's not. This is diagnostic for all of us to understand where we are and how we can address it. So that's the way we're approaching it. So it's not so scary.
this is exciting. You know, we fought for something like this 20 years ago when SOLs first became,
The
Mhm.
growth.
maybe 25 years ago,
Yeah.
where you're measuring how much a youngster learns as opposed to some test score up here at the top of the
Yeah.
level. And secondly, are we going to be able to provide the data that we get to the individual kid?
Mm-hmm. Yeah, and the parents will access that too. So we'll
Okay.
know exactly where they are. And when we make decisions about interventions or placements in certain groups, now we'll have all this data to show, well, this is why, this is the gap we're seeing, this is how we can come up with an instructional plan to make sure we can mitigate that gap as quickly as possible.
So each teacher will have that significant data,
Absolutely.
and counselors will have this.
Yes, and our teams will, and that's as an overall, we get the strand question detail. It's
good.
really detailed. So
This
we
is
will have,
exciting.
we
This
can
is
hone
really
it.
cool.
Yeah, it's in
Yeah.
development still, so, and that's why also it's, it's not a full rollout just yet, just like when we field test items on the SOLs and things, so they won't count against anybody, but they're feeling it all out to see how it works, and parents will want that feedback from you all too about, the interfacing of that, because we can provide that to DOE. I'm sure they're going to be looking for that as well. Okay.
And you said that about the parent portal,
Mm-hmm,
so you say they're working on it,
mm-hmm.
but it says here for the fall 2021 growth assessment. So
Yes.
they're working on it so that it can be seen
Mm-hmm.
in the coming school year.
Yes, they hope that the tests that were just administered, the parent will be able to get a code to go in and see their child's score.
Right.
So I haven't seen any links or anything to that data portal yet, but as soon as we know that it's available and how to access it, we'll be sure to communicate that.
Right.
Mhm.
Right.
Okay. Very quickly, we posted the VSBA policy updates here for you. Hopefully for adoption, there really wasn't much change at all. One was a typographical error, and the other was just some language that has to change because a code changed about non-exempt employee comp time. So if you could vote on that tonight, that would be great. And it is an action item later. All right, and then our regular well check update that we do as a standing item. So this is our current dashboard updated just yesterday. But we don't do quarantines until every Friday. However, the NCIS team has gotten so good and particular about all of that data, they believe they can now do it every 2 days. So starting Wednesday, we plan to update the quarantine data Monday, Wednesday, and Friday as well. So you'll be able to see an more accurate picture. So right now, this was based on the Friday numbers, and we were at 17 earlier when I checked. So 17 total quarantines right now. Here's that chart I think you were alluding to about where we started and where we're going.
Good.
Oops.
Shannon.
Sorry, the Zoom thing keeps getting in my way. All right, so there's that data dashboard from the beginning when we launched it. So as you can see, we started much higher, especially that gray bar, that's your quarantines.
Sort of brown.
Yeah. And then came up a little bit here between the September 6th and 8th, and it seems to be leveling out pretty well and coming down, but we still want it much lower under here. But having just that 5 cases as of yesterday is pretty astounding compared to where we were just a couple weeks ago.
What does the line represent?
It just shows you the trend of where those
Oh.
bars are going.
All right.
So she said in her presentation, we had 32 in the first 2 weeks, and then we're now up to 42, so we've had 11 additional
Mhm.
cases. So it's
43
significantly different, like it's only a quarter as many
Yeah,
since
significantly,
this
yes.
restart.
Yes, ma'am.
So that's progress. I'm glad to see it. Thank you.
So here's what the locality dashboard looks like from VDH right now. So as you can see, they're seeing a similar thing. This is Rappahannock community, so we're seeing it come down. All the epidemiologists and health directors we've been talking to on the calls seem to believe that we're having a quick spike and that it should start to come back down to baseline, so hopefully it's peaking. They won't truly know that, but looking at other models in other states who have peaked earlier, that's what they see, this kind of rapid rise, and then it starts to come down and level off. So we keep doing what we're supposed to do. Hopefully we can get that back down to baseline soon. Come on, go to the next slide. There you go. But community transmission data in the whole state, we're all red. So yeah, there's
Not much nuance.
not much you can do there. So everywhere in the whole state is in high transmission right now.
It is what it is.
It is, but here's a pretty awesome slide right now. So we took all the dashboards in the region just to compare and see how everyone is doing. And at this point in time, everyone has reverted back to mask required. Now, every division does have to deal with exemptions because that is part of the order. You have to comply with that, and different districts are doing it a little differently. But out of all of that, Rappahannock currently has the lowest active case count and quarantines in our entire local region after having one of the biggest case surges immediately. So thank you, NCIS and community. That's amazing. That's huge. And as you can see, we don't want our partners in other districts going through this, but they are. And they're having
Didn't I
trouble
just
getting
see 27 quarantines?
She said that currently it's
17
gotten
currently.
down to
Oh, it's gone down
Mhm.
since
But in proportion, yeah.
yesterday?
Hmm?
Since yesterday?
Yes.
Oh, all right, I'm sorry, I missed that.
So we also are a division that only has a little under 800 students. So how does it work, percentage-wise, how are we compared to other divisions?
We're still much lower, and we're getting control of it much quicker. And as you can see, the quarantines in other districts are really getting out of control. And that's where a lot of the districts are struggling in going to VDH saying, do we have any flexibility with all these quarantines? And there's something else we can do. So the case counts seem to be pretty relative if the other layered mitigations are in place. A lot of districts don't have the staff capacity right now to hire local contact tracing teams, so relying heavily on VDH to do most of that. And then you can look at, if you look at the rest of the Commonwealth, in Fredericksburg area, over 1,000 COVID cases and over 5,000 students and staff quarantined. Franklin County, over 600 quarantined in their first 2 weeks, 200 quarantined in Albemarle first week. Surge in Central Virginia. I linked all of these so you can actually see it. So this is not just an isolated Rappahannock problem. We just opened way earlier than everyone else. So we all got the same data and feedback and guidance and everything. So you can see this is not just us. But what we did was band together and really figured it out first. And we were able to share this out to whoever will listen to us too. We were asked to, and VDOE is asking for this data too, to survey our staff. So 84% of our RCPS staff are fully vaccinated at this point. So that's amazing too, because initially our first dashboard when they signed up was only about 65%. We had estimated it was higher than that. So we're at 84% right now. We have a vaccine clinic coming up. If you're one of those 15% and you still want to get vaccinated or you get your flu vaccine, that's this Thursday, 4 to 7 p.m. And it's free. It's Pfizer, age 12 and up, both your flu and COVID Pfizer vaccine can be given at the same time.
Is it you just sit in your car to get your shot, or do you go?
No,
into
you
the
go
school?
into the
Okay,
elementary
okay.
school, yeah.
It's gonna be in the clinic?
No, it's in the cafeteria and they
In the
have,
cafeteria?
intake tables and
Oh,
everything.
it's the, yeah, okay.
Yeah.
People are doing it,
Yeah.
obviously. I mean, it's the health department that's doing it.
Health department is running it. We're partnering with the
Right.
county government as well to put that on for everybody.
Well, I'm gonna get a flu shot. So
All right.
I'll see
Well,
you
we
there.
do have a lot of early flu cases, as we saw. Remember, we had those 9 flu cases that popped up that first week and a half or so. So flu is among us a lot earlier, so be ready for that too. Our wellness center has opened our on-site telehealth program. Of course, with anything starting, we've had to work out some kinks, and there's been a little bit of bottlenecking with the consent forms. So parents, be on the lookout. We are going to send home a packet that kind of goes through all of this with those consent forms. Signing consent forms does not mean you have to partake in that service. It's only if you want. We will always ask your permission before bringing anybody over there, and nobody will be tested or given any care or anything without your permission. So we'll send packets home with that, so you can have that up front, because when you do really want to be seen, and that's what we're seeing, we do have parents that sometimes, okay, now I really need my kid in there, can you get me in? Okay, but we really need these in place before we can do anything. So that's tying it up a little, but getting smoother. And I have to give a little shout out to Holly and the Commit to Be Fit team, because we are still really pushing on wellness and your own immunity and being healthy, because ultimately that is your greatest weapon against anything. So they have started this transformation program. So I know you've probably seen a lot of that if you're on social media. It's incredible. The team has put together a stay-at-home workout program, and you follow it, and it's just pretty intense and awesome, but easy to do to start off with, and they provide great support and all these pictures and put together booklets and everything. It's really great. So thank you, Commit to Be Fit team. And that is our well check.
Great, thank you. Any questions?
Yeah, I do. Actually, I've been, are we still basing our matrix on just Rappahannock?
Right now, our data, you mean?
Yes,
Our matrix?
Yeah.
For mitigation, you mean?
right.
Yeah, so we're using our local data, but right now we're in containment mode, so we are not unlayering anything. And the recommendation at this point is don't change a thing. Don't change anything. And we said we weren't going to touch anything for at least those 30 days. So that's why there's nothing on the agenda to change anything, especially tonight. At October, you could consider, based on any data, if you wanted to make any changes. But at this point, it's our recommendation. We don't change anything.
That makes a great deal of sense to me. I was doing some research, and I found that somebody had said, Rappahannock is not an island. So believe it or not, there's over 2,000 people that leave the county every day to work. And that surprised the tar out of me, that many. And there's 900 to 1,000 that come into the county to work from the Rappahannock, Rapidan region. And that's it's an interesting data that we should be looking at, because that's where we don't just have 7,000 people. We have more than that going back and forth in different areas. And I want to be thinking about, maybe we ought to use the matrix based on the Rappahannock, Rapidan County data that we talk about in the future.
Meaning we could expand the area to our whole health district when we look at whether to change or unlayer some of this mitigation. If we look at you're saying to look at the wider district.
I'm saying that we should be looking at the Rappahannock, Rapidan Health District to create our mitigation process in the future.
Do you mean, so we had criteria in the model that says we will escalate and de-escalate based on metrics, right? Whether they were
On the
local or
metrics,
the
right.
region.
I'm saying
I thought
we
they
should-
were already based on the region.
No, they were based on
the
Rappahannock metrics.
Or just our county. Remember, there were times where we had Rappahannock was this little green island,
Right,
and
so
then
right
there
now
was
we're-
yellow and red.
But we were considered moderate right? When we were here a month ago,
No, we were high
right?
a month ago.
A month ago, we were high.
We were high a month ago, Mr. Mills.
We
At the
were
start of-
moderate.
No, we were
we were-
moderate a month and a week ago, but we were high a month ago.
The last time we met, we were moderate.
No, we were high the last time we met, Mr. Mills. We were moderate when we met the week before the meeting that we had
Special
in
meeting.
August.
The special meeting.
Yeah, at
Yeah,
the special
right.
meeting, we were considered, the word wasn't moderate, we were at risk, we're the second from highest. And then a month ago, we were high along with all of our surrounding, we were red along with the surrounding counties. Which
So
is why we
I'm just-
could have predicted what
I'm just,
happened.
I'm just mentioning that for future. I know we're in the 30-day routine, but it might be beneficial to be thinking along those lines. I just couldn't get over the number of people that come into the county and the number of people that leave the county and go to other places to work and are exposed to counties such as Fauquier and Warren that have the highest rates of active cases.
So it's interesting that you bring that up too, because at the state level and at the state and through the CDC and VDH, these local metrics were developed for schools to make dynamic decision making based on, what we learned last year. And that was our guidance from that. So recently, now that schools are reopening, they seem to be changing that tune as well. So they're not recommending using the same metrics. They are recommending now looking at your community transmission data in taking it more weight, not just what's going on in your schools, because your likelihood of getting it because of the contagious rate that they're seeing in that. So VDH has changed, so you won't see that same pandemic dashboard for school metrics on VDH anymore. So even if I wanted to use it, I'm not sure I could pull off some of those data points because they're not going to let us use that now.
Good.
So yeah.
So that's something that will change as VDH
I don't know whether
Yeah.
do we need to modify what we did the last time after the 30-day process is over?
Well, and we're looking at this, and now that what we've learned, like I said, the administration and the NCIS team wouldn't recommend changing a thing until we get this thing sorted out. We see, what the data is doing, community-wide, region-wide, just because it does infiltrate so quickly. We can get a better hand on it because it is going to still continue. As long as these transmission rates look like this, we're going to still have it coming in. So we have to make sure that we limit the quarantines and limit that exposure as best we can. And we know we can stay open now at the highest rate. We can stay open and we can still operate. We can keep staff capacity up. I think that's everybody's goal. So at this time, after seeing how it's acted and behaved and how it really hides itself, because now it looks like a whole new COVID. And we thought we were getting ready for Delta variant, very serious, like bad illness, and it's not. It's for us. For us, we're seeing very mild. They're saying allergies and sending kids to school thinking it's not a big deal because we've been so accustomed to that. So it's a whole different thing. And with our vaccinated folks, Robin, correct me if I'm wrong, but their symptoms are even completely different too because they're coming on as a stomach ache, a lot of GI stuff for our vaccinated. So it looks very different. So we've had to learn and adapt. And now that we know how to handle it.
Good deal.
Okay.
So can we ask you and the team to make a recommendation to the board? Because I've heard a lot of anxiety, believe it or not, from parents about the possibility that we would, maybe in a month or two when our local numbers are down, but there might be higher numbers in surrounding communities, that we might go back to what happened again and then have another wave of COVID. I just want to do whatever we can to not have another wave. It's important, and we all know in this room that it's important to have school, right? So I just would love to get any, as you go forward in this month, recommendations, if we need to change or if we need to, because to some people, the idea of removing masks soon feels like an opportunity and a fun thing. For others, it feels like an opening of danger. And so I would love to see that we're not gonna, I just love to have a continuity,
Well, and with
of
the
school being open.
the health commissioner's order, now that that's in place too, we don't really have a lot of flexibility. It
Yeah.
can't be an optional situation.
Yeah.
There are exemptions that people are allowed legally
Yeah,
under the law
yeah.
that we have to deal with. And a lot of, and honestly, I haven't received any that have provided medical documentation that are ADA compliant for that reason. And that's what schools can request for documentation to remove that. So in those ways, that's what the recommendation is at this time, once that lifts. But we have to deal with those
Yeah,
exemptions
and they're
too.
very small in number.
They're very small,
Yeah.
yeah.
For what it's worth, I came for a salad the other day, and it was delightful to see the kids. I didn't see everything was just as calm could be, and it was school as usual per se. It was really good.
And we're hopeful. We're hopeful if we can get a handle on this and get these numbers down and other people follow and, the more vaccinations get out, and we should see these numbers come down and the order may be lifted. So that's kind of the goal right now. Let's get the health commissioner lift it for us so then we don't have to, play with all this funny litigation and, language.
Do we know what our over 12 vaccination rate is?
That, not yet. The state talked about that in a call today. They're trying to come up with a way that we can do that without, being too intrusive, because it's not a requirement at this time.
Yeah, sure.
But we can certainly survey parents and
And
you
see.
get what you get. It may not be as accurate as we'd like, but
There are some school districts are requiring vaccines for athletics.
there are.
Have you given any thought to that?
We haven't talked about it as an administration too much, but it doesn't look like something that we'd explore at this time.
Okay.
But that's more of a board policy decision.
Well, I think that's probably true. Ask you if you thought about it.
Right, anything else? Thank you, Dr. Grimsley. Let's move on to the report from Headwaters representative.
Right. I did meet with the new Headwaters director, Brittany Dwyer, who has taken the reins fully, and she's delightful, as we all know. The first item was that to mitigate the possibility of COVID spread during activities, the Headwaters board unanimously voted to require COVID-19 vaccination for all staff who has contact with students at this month's meeting. At the previous month's meeting, they voted to require masks for everyone participating in indoor parts of their activities with students and anything that's non-distanced. The after-school program started on September 7th with 39 kids signed up. They, for the first time, are offering bus transportation home. So that really helped a lot of families to be able to do that. They're hiring a bus driver. The bus driver is also happy to have some work. So it's really more work. So it's a good thing. And it runs Tuesday, Wednesday, Thursday, and there are 3 clubs: sports, arts and crafts, and life hacks for kids, which is an intriguing title. And there's a new program called the High School Connections Student Enrichment Grants. It's going to be unveiled on their website later this month. You know how Headwaters has been doing grants for teachers for enrichment in their classrooms. Now students can directly apply for a grant if they have an enrichment activity they'd like to participate in, like maybe a summer program, an arts program, music lessons, anything that costs them money that they might not have readily available. So that is just a really great idea, and they can apply directly. There'll be a link on the website. The new website is up and running, and the link is not there yet for this particular program. Or it is there now. Okay, it wasn't there when we spoke. Brittany, thanks for getting the up to the minute information. And she said there are 56 kids in after school. Wow, it's growing right back up to where it was back in the day. That's fantastic. The website is at headwatersfdn.org. And there also are 2 newly trained starfish mentors. They're ready to be matched with their mentees. There's another new program called High School Plus. It's now available for students who would like to have assistance for the dual enrollment fees that we've talked about. So when students take a community college class, they need to pay to get credit, and students in need can apply for grants for those credits as well. And there is a new internship that Headwaters is offering that I'm going to try to paraphrase because you gave me so much information, but it's called the rap writing internship. They're looking for a junior or senior who is interested in writing for the newspaper. They'll get a stipend. It'll be a 10-month period of time, and they will be expected to write 2 articles each month.
Wow.
That's a great opportunity for someone. And that's what I have from Headwaters. Is that
Thank you.
okay? Thanks.
Good. MVGS? Larry?
Oh, for me?
MVGS?
Oh.
Yep.
Actually, I wasn't able to attend the meeting. Dr. Grimsley went, but I understand there wasn't a whole lot done.
Oh, I'm sure there was. I just didn't bring my notes. But yeah, it was a quick meeting, and then they postponed this one till next month because of an incident that happened. So it's been quite a while since that last meeting.
That was a long time,
So,
2
because
months
they
ago, I
postponed the
think,
one
yeah.
we should have.
Are
Yeah.
they?
It was right after our last meeting, and so,
Are they
Yeah.
virtual?
pardon me?
Are they virtual?
No,
Or
they're
you
in person.
Still go in person?
There's been, I think, 1 COVID case at each campus. They've been masked and in person for the
Yeah.
whole time.
Mhm.
There was 1 case in Middletown a few weeks ago and 1 case in the
I think-
Warrenton campus.
Warrenton,
And they
right.
have about 70,
Yeah.
80 kids there.
That's good. I do have another piece of information. The Lions Club is offering an apprenticeship program where the Lions Club will pay for half of the salary of an apprentice if a plumber or electrician or carpenter or whoever wishes to have an apprentice, a high school student, on a work release program. And the Lions Club will pay half of that person's salary.
Wow.
So if anybody is interested, they can contact me and we can go from there.
Looking at Lee over there. Did you hear that? Okay.
What'd you say? All right, just come on. We will raise the money. We will pay half the salary. We've already had 1 student who worked at Mountainside therapy place last year, and that worked out quite well.
All right, thank you. We're going to move on to public comment. If you'd like to address the board this evening, I ask you to rise and come to the podium and state your name and your district, and to try to keep your comments to 3 minutes, because if everybody takes a turn, let's see, we'll be here over an hour at that rate. So if you'd like to address the board, please.
I want to see some volleyball, so that's why I got up here real quick. My name is Jimmy Swindler, Stonewall Hawthorne District, represented by Mr. Larry Grove. I very quickly, hopefully less than a minute. First of all, just a throw out to Nurse Robin. What a great presentation. Thank you. And the only question I have with the use of the pods, does that mean that our school is now potty trained? You knew it was coming. Seriously, well, a little more seriously. I wanted to come tonight because I wanted to commend this board and the administration for making some tough decisions last month and leading up to last month under what I consider to be unfortunate and truly unnecessary pressure. I had planned to come to the meeting in August, and I'm sorry, and I think many others too were sorry they did not. My heart goes out to you all. I can't imagine the tough situation that you all were in, and I know that in your hearts you made what you felt was the best decision, and I commend you for that. And I also commend you for having the courage to realize that, okay, maybe that decision wasn't so great once they got on the ground and started running, and you didn't hesitate. You didn't hesitate to authorize your chief executive to make the changes that you needed to make to keep our community and our kids safe. I, for one, couldn't ask for better leadership from our community, and I sincerely thank you. And the last thing I want to say is I just hope that in moving forward, we've heard talk about data and metrics and dashboards and so forth and so on. I just hope that you will strongly consider keeping the mask mandate in place for as long as it takes us to get a handle on this thing, and maybe even a little bit longer. Related to that unnecessary pressure, my phrase a minute ago, I was shocked when I was reading in the paper some of the many comments and on social media that a lot of parents made about what their kids were going through with the mask. I got to tell you, as many of you know, I was here last year, and we had a mask mandate in place all year long. And I had exactly 2 high school students that I had to speak to about the mask in the whole year. 2. One to be fair, make it 3, because one of them, I remember I had a conference with them in the hallway. And they got it. The kids got it. And that's always the case. The kids get it. So please know your kids get it. That they know that wearing this mask isn't so much about them as it is about everybody else. It's about all of us helping to protect everybody else. And I just, again, I urge you to please keep that in place, at least for the foreseeable future, for all of our benefits. And again, most importantly, I commend you for doing such I can't even imagine why you guys do this. My hat's off to you every day. Thank you very much.
Okay, Jimmy, next. Who'll be next?
Good evening, Dr. Grimsley, Mr. Chairman, ladies and gentlemen of the board. I too want to say how much I appreciate having just been through the process with the team, with the NCIS team.
Can you identify yourself?
Oh, I'm very sorry. I'm Arthur L. Goff. I'm from the Hampton District. And I haven't just experienced it firsthand. I wanted to point out one item I think which is important, and that is that, and I agree with Jimmy that we're all in this to try to protect each other, and we're certainly wanting to keep a healthy and happy community. But at the same time, I think one little thing sometimes drops through the cracks, and that is the idea of due process for the individual. Sometimes the process as it's applied can result in an unjust or incorrect result. And of course, I'm always talking like a lawyer because that's what I am. I'm a lawyer. So due process, it simply means an adequate notice to the individual and also the opportunity to be heard. I don't want to get into the weeds of my own personal experience here, which I will follow up with a confidential memorandum to this board along those lines. But what was most frustrating to me, and I guess because I am a lawyer, is that there was no avenue of appeal. Where we have a disagreement about not only just the physical tests, but the symptoms and all that went before, the days, the chances of exposure, and all those tiny details. But when added up, I think made a compelling case that, in my case, that the quarantine was not called for. And the reason that's a big deal is there are collateral consequences to a quarantine. My wife's a school teacher. God bless her, and God bless all of you and what you do. School teachers are the best. But she had to take 6.5 days of her own personal leave. And I'm kind of lucky in my situation is I'm rather flexible in my schedule, but at the same time, it does place a burden on parents, and it could be a financial burden for a lot of parents, having to lose work, especially in a 2-parent income thing. So we have to not be cavalier. And when there is an argument to be made that a child is not COVID positive, that person needs to be heard. I really applaud the detail of this plan that Dr. Grimsley and her team has come up with, because I think it's fundamentally rational. You know, the limitation with the seating charts of who can be exposed, that drastically reduces the number of quarantines, which is very important. My son, special needs. He lives for school. He loves school. He absolutely loves this place.
Yeah.
And when he can't come here, it is devastating to him. So for me, I'm extra sensitive to the fact that I want my kid in school at all possible costs, and I want to advocate for it. And I can understand when other parents might feel the same way. Now, there might be some obvious cut-dried, easy, okay, my kid's got COVID and he's got to stay home and I got to suck it up, right? But not always. So here's what I have to suggest, humbly, that you adopt as part of your return to school policy, the overarching policy, a system similar to that a child would be entitled to if he were being expelled or temporarily suspended for a disciplinary problem. Okay? So here's what I propose, that, and I'll volunteer to do it, a neutral fact finder who can hear an aggrieved parent's argument about whether or not, hey, does my kid really have COVID, or does he have the sniffles? That slide, I believe it was number 9 on the earlier presentation. This thing looks like Seasonal allergies. I've got seasonal allergies. My kids got seasonal allergies. It looks like the common cold. So you need maybe sometimes what they call the gold standard test, which is the one that Dr. Grimsley pointed out quite rightly is really hard to get right now. So, but based on other health considerations, including, as your policy now includes an alternate diagnosis by a physician, that needs to be adhered to. It wasn't in my case, but that is an important thing. If the doctor looks at it and says, no, I mean, the kid's got bronchitis, he's got COVID, he should be back in school the very next day. And so, and if that is not afforded, then we need to have somebody outside the system, because, systems tend to kind of militate and protect themselves, and rightly so. And that happens in every kind of I hate to use the word bureaucratic, but I can't think of another one, situation where sometimes the system, sort of like the movie Space, whatever that was, where the computer HAL takes over, so protecting itself. And so we need an outside fact finder.
Right.
In the event that a parent disagrees. Did you have, what were you saying? I'm sorry. I thought I heard somebody saying something to me. I'm not crazy, really, true. I just thought I heard somebody talk. In the event, and I submit probably the rare event that a parent might want to be heard on that, somebody outside the system to do that, and I'm here to tell you that as the Commonwealth's attorney in this county, I'd be happy to take on that responsibility as a neutral, detached hearing officer, if the board were so inclined. So that's essentially what I want to leave you with. As I said, I will follow up with kind of down in the weeds analysis, which I hope will be helpful. And believe me, I come to you in a spirit not of criticism, but of, I want to improve the situation.
Yeah, appreciate the feedback. That's very good. Thank you.
Thank you very much.
Thank you very much, sir.
Sorry about that.
Very interesting. Thank you. Who will be next? Yes, ma'am.
I'm Missy McCool, and I'm in the Hampton District. Ms. Meyer is my representative. And I don't usually attend school board meetings. You guys haven't seen me here because usually I think you guys are doing an amazing job. And I back up the teachers. Ms. Grimsley knows who I am. I'm also on the PTO, the vice president. But last month that really didn't happen. And you guys did something that never occurred to me that you would do when you opened the schools without the mask mandate and without the precautions that we had last year that were so successful. And that was really, it was a bomb going off. My daughter is in the 6th grade. I was personally affected because she made it to school for 3 days before I got a call from the lovely Robin Murray, who is fantastic. But my daughter was in the 6th grade class that had a COVID positive individual, and then the entire 6th grade was out, and she was out of school for 3 weeks. We didn't have to start school that way. And I don't like to be a critic, but it really went down horribly. She didn't have her computer issued yet. Her courses were not online. So we had a big hiccup, and tonight we talked about learning loss. This is going to fall into that category for these students. And I think to even suggest looking at matrix numbers for the county and to talk about easing the mask mandate at this point would be akin to the Virginia Department of Transportation deciding that because last month we had fewer fatalities, that this month we should relax seatbelt laws. I think to even discuss it at this point as far as losing the mask mandate is extremely premature. We should keep the masks on. We need to keep the precautions up. We need to keep everyone healthy, and we need to keep everyone in school. So that's what I came to say today. Thank you.
Thank you. Who will be next? Yes, ma'am.
Hi, My name is Tiffany Matthews. I live in the Wakefield district, so Chris, you're my representative. I think I sent a kind of communication log, a petition
You
to
get
the
close
school
to the
board.
mic. Yes.
Sorry.
If you can go ahead and talk, and I'll pull that up.
Okay. So last week I created a petition as a communication tool for members of the community to express their support in following the guidance of our public health officials and to kind of keep our masks on in school, to do the measures that we know that keep our students safe and our staff safe, and add to more in-person learning days. So right now the petition's at 200 signatures, more or less. Some of them are a little wonky on there. But yeah, I created that so other people could have a voice and an easy way to contact their public officials to express their desire to follow guidance from BDH and other public health officials.
Okay.
Do you have the words of the petition? What was the petition?
Sure.
I'm going to pull that up if you need it. I'm sorry, Zoom
It's
people. I
okay.
had to stop sharing so I could get into my email to get that for Miss Tiffany.
So the petition says, to the Rappahannock County School Board, we want RCPS students to be in school, safe, and focused with their classes and activities. The best way we can achieve this during the escalating COVID-19 pandemic is by faithfully following public health recommendations and mandates, including universal masking without exemptions. We have now lived through multiple school-based outbreaks while very few are masked at school. We want to do all we can to curtail hardship, missed school, and serious illness or death from the pandemic in our community. Therefore, we request that the current local COVID-19 model be discarded in favor of a simple statement that Rappahannock County schools will adhere to the mask mandate along with the full complement of mitigation strategies without exceptions until such time as the mandate is lifted. Let public health officials, not politicians, guide our pandemic response and mitigation strategies. We would like a school schedule modified for outdoor safe mask breaks for each student each day, and hope that schools will creatively employ other methods so interactions can be both safe and distance and personal and friendly. So my personal reason for signing the petition was I was signing for my daughters, their friends, classmates, and staff to be safe and healthy in school.
I noticed on the the very first list, that a great number of those people, they're not from Rappahannock County. They're all over the U.S. There's people that are signing the thing that are not.
And to the
I mean, there's
You want to see the full list?
yeah, there's like
I printed it
50.
from our email.
Right, but
Yeah, so
what I'm saying is
see a
they're
page.
not.
Look at the zip code, sir.
Yeah, I just looked at it before I came to the meeting, the one that I was emailed, and I'm just saying there's 50 or so that aren't even.
Not 50, sir.
Could
Would
you
you like to look
pull up the spreadsheet, the
Yeah,
Excel
would you like
sheet?
to look at them?
Let me see if I
Thank
can
you.
get
Oh,
that
I
one.
got
Sorry,
it.
have
So
to
I
go back.
received the email. I received the email at about 5 o'clock today. I scanned the list, and what I'm telling you is I see people that are not Rappahannock County people. So all I'm saying is, if we're going to consider the data, let's clean it up. That's
I'd
all.
like to do that for you now, sir.
Well, I'm going to believe what I got in the email message.
Yeah,
I'm not sure
you
what's,
better read your email.
there's no need to get this way.
From what I could see, I think the majority of it was from Rappahannock citizens signing the petition.
All right. Thank you very much.
Thank you.
Who will be next?
I'm trying to keep up here. Sorry.
Print journalists don't speak to crowds, so apologize for that. I'm in a unique position that I cover 2 counties. I get to see the good and the bad in both counties. In the past couple of weeks, I've seen a lot of good coming out of the school system in Rappahannock County. Your dashboard, you show the quarantine. Took me a week in another county that I cover to find out how many students were quarantined in the school itself, not the outside people, but just in the school itself. The answer I got was very low number. I covered a football game Friday night. Unlike you all, they have 36 players on the team. 12 of them were quarantined. 25% of the football team was quarantined. 6 of them were starters. They had kids came up off the freshman team playing a position they've never played in their life just so they could have a body on the field. I appreciate the quarantine that you all have on your dashboard because it tells the community something that they need to know. About a month ago, when y'all started school, Shannon and I was talking on a daily basis, sometimes twice a day. Early in the morning, late at night, trying to get a handle on it because we as journalists are tired of this also. But we have to report what we have to report. I was talking to Shannon one day in her office and I said, do you feel like a yo-yo? Up and down, VDH, local health district, the governor, CDC, parents, staff. She said no. She said she felt more like a bobblehead. So if you're going to feel like a bobblehead, you should be a bobblehead.
Did you get a Shannon bobblehead?
No, sir. Let's see.
And what does Shannon sign on the bottom of every letter she writes?
Cheerleader in chief.
Okay. So if you're going to be a bobblehead, you might as well be a cheerleader.
That's awesome.
Chuck, thanks for bringing some levity.
There you go,
Yeah.
Chuck.
That's a classic.
I guess the mask makes it easier to have a likeness of yourself.
Actually, I'm thinking we want to get around. That's awesome.
Oh my goodness.
Let everybody get a pick. Hold on. Anybody else? Anybody want to pick?
Thanks.
Hey.
That's really cute. He even has a Panther jersey on his
Chuck, remember that old toy we used to have with the ball and the rubber string?
Uh-huh.
There you go.
Yeah.
There you go.
All right, thanks. Who will be next? Yes, ma'am.
Crafted that from this over to your hands.
So it's good. It sounds really loud to me. My name is Kristen Gregg. I'm in the Hampton District.
I'm sorry, what's your last name?
Gregg.
Greg.
Yes. So I just wanted to point out what was put on the screen was actually the handwritten, hand signature portion of the petition. And what was emailed was one that went out via email. Has to this point 230 signatures. I'm not sure how we're verifying which ones are Rappahannock and which ones are not. I think we could probably maybe figure out that pretty quickly, and I think we'd still have a pretty high number of people in Rappahannock County who have signed the petition. The second thing that I would just want to think about as a community, I've heard it mentioned that this virus is behaving in a sort of mild manner with some of our children who are showing very few symptoms, and that's great for those children, but those children are coming out and interacting with their fellow community members who may have a more severe case, should they contract COVID. So that's all, and thank you for hearing me out, and thank you for all that you have done.
Thank you. Who'll be next? Yes.
I am Ellie Clark. I'm from Pud Myers District. And I wanted to say I heard something that upset me quite a bit. And I know that I had two sons who had a lot of really good educational experiences in Rappahannock County compared with Fairfax County, where we moved from. And I wanted to say that I think it's wonderful that we continue teaching values and morals and respect for each other and honesty and everybody going by the same rules. I understand that there was some bullying, mask bullying on school buses. And that would be telling somebody they're a wuss or whatever if they're wearing a mask on a school bus. And they have to wear a mask on a school bus. That's the law. And that should be enforced all the time. If it's not, something's wrong. Something's not fair. But I really fully support mask wearing. I'm an RN. I know that that's what we need to get through all of this experience with COVID. So I just want to please, remember that my mask protects you and your mask protects me. Thank you. And let your children know that that's the deal, It doesn't make sense to make fun of somebody who's wearing a mask when they're protecting you.
Thank you. Who'll be next?
Beth Gainer, Hawthorne. I just wanted to let you know how much I appreciate all the work you guys have been doing, and want you to know that I'm like to support you in the decisions that you made previously at the different meetings. I know that they have been hard, but I appreciate them, and I appreciate that we are working with data-driven decision making. And because of that fact and the decisions that we made previously, I've been able to keep my children in this school system as opposed to taking them out and finding a different alternate way of educating them. So I just want to let you know I'm very happy with what you have done, and I understand the governor's mask mandate, and we work with that, and we work with the data-driven, and if we have to mask, we mask, but I want to make sure that we understand that should be temporary depending on what's happening in our communities, and that masks shouldn't be something that the children have constantly. It should, like we've discussed at previous occasions, children, little ones who don't know anything but masks at this point, who are scared when they see people's faces. That's not something that needs to continue on. We need to be able to stop when it's time to stop and let them have that break and go back when we have to go back. But I just want to tell you that I appreciate everything you've done. Thank you.
Thank you. Who will be next? Anyone? Yes, ma'am.
Shauna Balmerick, Wakefield District. And I just want to say this was really informative, and I really appreciate all the information and the data you've presented. We pulled our kids out of school this year. One of the families that did that when what I've been calling the debacle from the first week. My husband left his job to homeschool them, so it's been really challenging to say the least. But this is really encouraging, and we've been telling our kids we're watching the numbers, and they want to go back. They got their favorite teachers this year, their best friends in their classroom. We want them to go back. So we're really looking forward to that, and this is what's giving us really positive encouragement that we can feel comfortable sending them back, knowing that masks they work. This is science, right? It works, and so we're really excited to see that. And I know this is a county that has a lot of polarization and divisiveness. at times, and it's nice that we can work together, and I know it's not always easy, and so I thank you for the tough decisions, and we are really looking forward to sending our boys back to school soon and getting back to some normalcy in our home too for that, so
Great.
thank you.
Thank you. Anyone else?
If there's anyone on Zoom that wishes to address the board, you can raise your hand and we'll unmute you so you can address the board. I have Ellen Adams.
Can everyone hear me?
Yes, ma'am.
Yes.
Okay, Ellen Adams, Wakefield District. Just very briefly, I'm following on the heels of Mr. Swindler and Ms. McCool. I also want to commend Dr. Grimsley and her team for the hard work. It's so impressive to sit here and see the detail and all of the protocols that have been analyzed and put into place. And I also want to really strongly urge you all to keep those protocols in place even beyond when it might seem like things have let up, because we know that this, the variant comes and goes, and I know you're following the matrix, but I just urge us to keep the things that have been working in place so that we don't have to backpedal at all. And just remember that this is a community issue, and this is not an individual rights issue. This is about community members taking care of each other, and I really commend you for your actions along those lines. Thank you.
Thank you. Any other hands raised? How many people are online? Can you tell?
I have 10 participants online. If anyone else wants to address the board, you can raise your hand. Mr. Chairman, I see no other hands raised.
So for the near term, we're going to continue to do the Zoom model at our meetings. If you can't get out to our meeting and you want to participate or listen in, you should. The announcement that we make about the meeting will have the link in it, and if you have good bandwidth at your house, you'll be able to participate.
I have two messages that wanted to be relayed to the board by constituents. The first is this one. My name is Shannon Ennis, and I live in the Hampton District. My son is in kindergarten, and my daughter is in 2nd grade. I ask that you keep the current mask protocol in place. Masks not only keep them safe, but help to keep them in school. My son has only been in class 13 of the 24 days this year at no fault of his own. There's no way a kindergartner will learn without consistency. My daughter, who already struggles in some subjects, was just quarantined along with her desk mates. She had to complete assignments at home with no teacher instruction, as was the case last year with virtual days. I am not a teacher, and I have no training to explain necessary curriculum to my children. My husband and I both must work and have to have alternative days off to be home. We also have had to pay a significant amount of money to have our children tested when required by the school because of a possible exposure or signs of a symptom. Rappahannock County currently has no testing sites, and the urgent care in Warrenton charges $150 for each rapid test. There is no vaccination available for my children, so I ask that you all try to keep them as safe as possible this year and keep requiring masks to be worn in school. Thank you for all of the time you put into serving as a school board member. It is very much appreciated. Sincerely, Shannon Ennis. I have one more from an ER nurse. There are 4 to 6 hour minimum wait times at urgent care centers in Front Royal, Winchester. I've seen 7 to 8 hours at times. All urgent care online reservations are mostly full by the time we open each day. There are 12-hour wait times at the ER on average, and there are no ICU or critical care beds in Valley Health System at this time.
All right, anyone else? Last chance, last call? Anybody? Yes, sir. The homeschool teacher.
Yeah.
That's hard work.
Slash chef slash farmer.
It's hard work.
Country farmer, yeah.
And
My name is
chef.
Brian, trying. My name is Brian Vollmerich. My better half already commented. Wakefield District. I am a resident of Rappahannock County.
Real close.
Resident, Rappahannock County. You got come heres and you got from heres in this county, and our family wants to be a stay here. And we had serious reservations when the school year started and everything that happened. Having seen this and what Nurse Murray and their team has done is pretty commendable, at minimum to say the least. I just want to reiterate what other people have said before. Oh, my name is on that petition as well, Mr. Mills. In case you wanted to check that out as well. But the other people have made comments before about continuing the mask mandate. I see no reason to lift it. It works. Let's keep it going. And as far as, people, I don't have a youngster who I can't really explain the masks to, so I can't really relate to that. But I know with great challenges comes character building. And a lot of time people can probably reminisce about some challenges they faced in their life that they can smile upon now and see as a way they gain strength. And that's really all I wanted to say. And not a public speaker. Pretty good at exponents right now. And if anybody wants to know cell anatomy and what the Golgi apparatus does, I will be able to explain that. And that's character that I have built upon in this challenging time. So thank you very much.
Yeah, thank you. Contributing to this frustration, so when an edict comes to K to 12 school and it's not levied on the rest of the community, for example, the workplace, back when we went through COVID the first time, the workplace was given flexibility to the employee that allowed families to try to work through this whole thing together, right? And it's stretched our families and stressed our families, because when you have to quarantine a child and you can't get away from work because they're inflexible, because they don't give you the room to do that anymore, it's creating a stress on our community, right? And so I've experienced it because my daughter's experiencing it, and so I think it's good for us all to remember everybody's stressed out, everybody, and I think it's because the whole thing's been handled a little differently than the first time we went through COVID, when there was ultimate flexibility to manage our homes. So that's unfortunate, but that's where we're at. Anyone else? No? All right. We are Rappahannock. Right. We will persevere. Thank you for your comments. Moving on to action items, is there a motion to approve the August VSBA policy updates?
So moved.
We have a motion, Mr. Groves, is there a second?
Second.
Second from Ms. Bynum. Is there any discussion? All in favor, aye?
Aye.
Opposed, no. Is there any new business?
I could just update on so there was a meeting with the Friends of Rappahannock at the elementary school the other day, and they're looking at a real good just makeover of the grounds around the elementary school, including some new native plants, as well as creating an outdoor classroom space around some of the PTO picnic tables, PTO ladies, there's gonna be sort of an outdoor classroom hedge around some of them to create a space for more outdoor learning. So I'm hoping that some of those concerns that Ms. Gaynor was speaking about in terms of just having more spaces to be outside at both schools can be addressed. And there's a lot of people in the community ready to give free advice and free landscaping things. So I think we can work creatively within the constraints that we have in the pandemic, and still have a good time and some new fun stuff happening.
Right. The next regularly scheduled board meeting is October the 12th at 6:30 in this room. And at this time, we're going to be moving into closed session. Mr. Grove, you have a motion?
I do. I move that we board convene into closed session for the following purpose: to discuss and consider the appointment of staff for classified position, coaching positions, and resignations of professional positions pursuant to Virginia Code Section 2.2-3711A1 and II, discussion of pupil personnel 2021-2202 pursuant to Virginia Code 2.2-3711A2.
We have a motion. Is there a second?
Second.
We have a second from Ms. Bynum. All in favor, aye?
Aye.
Aye. Opposed, no. So we're going to be in closed session for approximately 20 minutes, and we'll be back in this room to certify and close if you care to hang out.
And those on Zoom, I'm going to end the Zoom feed